Hi, my name is Yvette, and this is how to administer a subcutaneous injection. First, what we're going to do is we're going to gather our supplies. I have my gloves, my alcohol wipes, some gauze, my medication, my syringe. This is going to be a 25 to 27 gauge needle with a 1 ml syringe, and my needle inch size has to be 3/8 to 5/8. Okay, my medication, hand sanitizer, and my sharps container, and my patient. Okay, so first what we're gonna do, I'm gonna verify my medication. So it looks like against the EMR system. It looks like the doctor is ordering heparin 1,000 units given subcutaneously for 1 dose right now. And it looks like the medication that I have is heparin 10,000 units per 10 mLs. So once I do my calculations, this is going to be 1 ml that's going to be drawn up for the patient for the dose of 1,000 units subcutaneously, okay? So first we're going to do, and that's going to be my first check, we're going to come into the room. We're going to provide for privacy. I'm going to introduce myself to, I'm going to do hand sanitizer, and I'm going to introduce myself to the patient. Hi, my name is Yvette. I'm going to be your nurse today. It looks like the doctor has ordered some heparin for you today. This is an injection. It's going to take a couple of minutes, but this medication is a blood thinner that's going to help prevent blood clots for you. Can I have you confirm your name and date of birth for me, please? Jane Smith, January 1st, 1950. Perfect. Thank you so much. Do you have any allergies to any medications that I need to be aware of? No? Perfect. Again, so we're going to be, the doctor has prescribed a blood thinner for you to help prevent blood clots. There is some possibly side effects with this medication. You could get bruising, and there can be increased bleeding time. That can happen. Some adverse side effects that we would need to be aware of, or you need to let us know to be aware of, will be blood in the vomit or black tarry stools. Those type of effects, you would need to call us right away. Okay, do you have any questions for me? No? Perfect. So first we're going to do, again, perform hand hygiene, and we're going to start preparing our medication. Again, the doctor ordered 1,000 units subcutaneously. To be giving subcutaneously, and that's going to be from our heparin. That's 10,000 units per 10 mLs. That's going to be 1 ml. So first we're going to do is we're going to grab our medication, and I'm going to again check it with the patient. We're going to open up our vial. We're going to clean it. Alrighty. And then we're going to get our syringe. Again, the syringe that I have is 1 ml with a 25 gauge and 5 to 8 inch needle. Okay. I'm going to open this up, and we are going to be giving 1 ml. And I'm going to show you. It's 1 ml. We're going to take out all the air. We're going to pull it up to the air. We're going to uncap. And we're going to go directly down and put all the air in. We're going to flip this over. We're going to make sure we go to 1 ml. We're going to tap, 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 take out any bubbles that it might have. Perfect. Put this down, and we're going to recap with 1 hand. Perfect. Again, I'm going to show you that it is 1 ml. Perfect. Now we're going to do again heparin 1,000 units subcutaneously, 1 dose, which I have heparin 10,000 units per 10 mLs. And we're going to give 1 ml. Okay, so first we're going to do is we're going to prep the skin. So for a subcutaneous injection, this could be given Today we're going to be giving it in the lower abdomen, but it could be in the lower abdomen, the back of the arm, or the upper thigh. Okay, so first what we're going to do is we're going to check the site. We're going to inspect the skin, check the skin integrity, make sure there's no signs of infection, bruising, anything that jeopardizes the skin. My patient looks really good. So what I'm going to do is I'm going to start from the inside in. I'm going to work myself out and clean the skin at a circular motion too. Okay, so after that, I'm going to then allow that to dry. I'm going to allow it to air dry like normal. Give it a couple minutes. So this shot, I'm going to be giving it either a 90 or 45-degree angle. Okay. So what we're going to do is we're going to, look at it this way. We're going to grab the skin. We're going to squeeze. I'm going to give it at a 45. Inject. And slowly inject at 30 seconds. And we're going to hold here for a second. And then we're going to slowly take it out. And we're not going to recap. We're going to just put it in our thing. We're going to put a gauze right over the site. We're not going to massage or anything like that. We're just going to put slight pressure. I'm going to look at the site, make sure that everything is okay. If there's no bleeding, which there's not, there's no need for a bandage or anything. So everything looks fine. Are you okay? Perfect, thank you. And I reminded the patient that there might be there was some tingling, or that it was normal to feel tingling or a slight burn when I gave the injection. Okay, so we're all done here. I'm gonna take off my gloves. Trying to save these for another video. We're gonna thank the patient. Thank you for allowing me to give you your injections today. I'm gonna pull them up, get them back in a comfortable position, make sure that they have their call light, and I'm gonna take all my trash, and I'm gonna leave the room and document this procedure. Thank you.